1,
2, 3, 4.
5.
Hello, my name is Avery O'Brien. This speech is to inform my audience about leukemia. Leukemia is a cancer that affects the blood. There are many warning signs for leukemia, and depending on the person can depend on what kind of treatment they receive. Even though leukemia can affect so many people, this cancer has a high survival rate. It is important to learn about leukemia so people are aware and educated on this topic and its warning signs. I am credible to give this speech because I have done a lot of credible research on this topic. Leukemia is a very complicated type of cancer. There are 4 different types of leukemia: acute myeloid leukemia, chronic myeloid leukemia, acute lymphatic leukemia, and chronic lymphatic leukemia. The most severe type of leukemia is acute myeloid leukemia. I got this information from www.cancer.org. Anyone can be affected by leukemia. The risk of most leukemias can increase with age. For acute myeloid leukemia, chronic lymphatic leukemia, and chronic myeloid leukemia, it is most common in ages 65 and over. Most cases of acute lymphatic leukemia occur in people under 20. Men are more likely than women to get diagnosed with leukemia. Many types of leukemia are slow-growing cancer cells, so they are diagnosed later in life. If the cells are fast-growing, that is when people are caught in that's when cancer is caught in younger people. I got this information from www.cancercenter.org and www.healthline.com. Since leukemia is so common, you should be aware of the early warning signs. It is important to know that warning signs so you can better understand what leukemia is. The warning signs are fever and chills, persistent fatigue or weakness, losing weight without trying, swollen lymph nodes, enlarged liver and spleen, easily bleeding or bruising, recurrent nosebleeds, tiny red spots in your skin. If you notice these signs and they worry you, make an appointment with your doctor. Usually leukemia is often found while doing blood tests for other conditions. I got this information from www.mayoclinic.com. It is important to know the warning signs. If you and your doctor can spot the warning signs, it'll be easier for your recovery. Catching it earlier can help tremendously with the survival rate. There are numerous warning signs and symptoms of leukemia. Most of them relate to other symptoms, so contact your doctor and make an appointment if these signs worry you. After you find the warning signs and get diagnosed, you can go through different treatments. Treatment can be a tough thing to go through for any type of cancer. There are 7 different treatment types for leukemia. These treatments include chemotherapy, targeted therapy, radiation therapy, bone marrow transplant, immunotherapy, engineering immune cells to fight leukemia, and clinical trials. Although some of these treatments are riskier than others, chemotherapy is the most common and most successful type of treatment. I got this information from www.mayoclinic.com. I hope this speech helped inform people on what leukemia is, what the warning signs are, and what the treatment options for leukemia are. There are 4 different types of leukemia. There are also many different warning signs that you can look out for. If you experience these warning signs or symptoms, contact your doctor. If you are diagnosed with leukemia, talk to your doctor about which of the 7 treatment types are best for you. Thank you for listening to my speech.
3.